According to a new study, women are more likely to have their work impacted by the pandemic.
In terms of what families are dealing with at home, with the challenges of educating children from home and juggling work, but also the jobs that have been the essential workers.
Change the Story Vermont, the Vermont Commission on Women, and Vermont Works for Women work together to gather data on the status of women in Vermont. Lisa Senecal, chair of the Vermont Commission on Women, says 91% of nurses in Vermont are women, 82% are healthcare workers, and 82% are personal care workers.
It's put women at higher risk for COVID, and it's also put a greater strain on their ability to be flexible for their kids.
According to the Vermont Commission on Women's website, 81% of women make up tipped wage workers.
In the 2008 recession, the majority of jobs that were lost were high wage jobs. And this time they're low wage jobs. The high wage jobs are coming back more quickly. And the low wage jobs are held by women more than men.
And Senecal explained these impacts are greater for women of color.
Throughout the country, Black women and members of other minorities hold the disproportionate number of low-wage jobs.
Ronnie Baston from Vermont Works for Women says while they have been able to get women work in high-risk jobs, many women have needed to switch their jobs because of childcare. But she says on Labor Day, she wants to remind everyone of gender equity in the workforce.
We're trying to do more gender equity training kind of on frontline workers. So that way we can really ensure that our participants and the women that we're sending into industries feel supported.
Courtney Adelman, Local 44 News.